So I'm going to go ahead and run through this. This is Advocacy and Caregiver Group Basics. This is my first presentation for Brightbot here, and I just wanted to do something fairly simple on a topic that I'm unfortunately all too familiar with, and that's advocating for a patient as a caregiver. Again, at the end of the presentation, you have an opportunity to ask questions. If for some reason you have a burning question during the course of the presentation, and I can take it during one of the slides, just go ahead and raise your hands or hand, and we'll go ahead and try and answer your question. First slide is just as it is, Advocacy and Caregiver Group Basics, a little bit of background information on me. I am an attorney by trade, executive director for the Max Cure Foundation, which is a childhood cancer organization, co-founder of a childhood cancer laboratory out in Beaverton, Oregon, and a few other appointments there after. This is just the outline really quickly. In thinking about this topic, there's a number of different salient points that I think need to be made. Of course, I could probably spend days talking about what it means to advocate on behalf of a patient or advocate as a caregiver. And everybody's going to come into this with their own experience. And so, it's going to be valuable at the end to share your experiences as well as we go through questions. So first things first, defining advocacy. Why do we even need to advocate at all? When to advocate, and the considerations involved with advocating for someone. And then again, at the end, questions. Advocacy defined. What exactly is advocacy? This slide, the visual, I think, says it all. Think of advocacy when advocating for somebody as a bicycle wheel. And in the center is the hub, and then the spokes radiate out. And along the way, as you're advocating for somebody, especially in the situation where somebody has a serious terminal or life-threatening condition, there are so many different spokes on that wheel between insurance carriers, caregivers, clinicians, researchers, psychosocial element. There are so many different aspects to what you may need to advocate for that you just have to be mindful. Anything can pop up and arise during the course of trying to help somebody as a patient. The advocacy is defined loosely as it's an act or process of trying to support a cause, or in this case, advocate for somebody through the healthcare system. There's a difference, I think, between advocacy and activism. Activism, as I think about it, is more taking direct action to advance a political or social agenda. It connotes something a little bit more aggressive than advocacy in this context, although be mindful that some points in times during the course of advocating for someone in a critical medical situation, you may have to become fairly aggressive. And we'll talk about how to weigh out when to really put it all on the line and when to advocate in a reserved fashion. As a caregiver, as a patient advocate, you're trying to ensure that somebody is obtaining the services that they should obtain, whether it's the standard of care or whether it's through the insurance carrier. Again, think of the bicycle wheel and the spokes that you have to look at. So moving on, why do you need to advocate? Well, if you don't advocate for your loved one, your family member, then nobody else will. And this slide in this picture is a picture of me and my daughter, Alexis. Alexis was diagnosed with a terminal brain tumor when she was 27 months old. She was given approximately 9 to 12 months to live. She survived and fought for 33 long months. Along the way, there was a lot of advocacy that needed to be done on her behalf. She couldn't advocate for herself. 27 months old, she couldn't even articulate often how she felt. So as her father, as her parent, as her parents, we were forced to stand in her shoes, and all the time we were advocating for her. Throughout the course of her her diagnosis and her treatment, we fought insurance companies, we fought on-call physicians, we fought ER doctors, we fought to get her enrolled in clinical trials. It was a constant battle. And if we didn't do it, there was a standard protocol that she would get, which was radiation. Radiation is palliative in nature for kids with what she had. She had something called DIPG, which is a brain tumor that can't be removed. Again, standard of care is radiate the child, wait till the symptoms come back, and then generally it's a matter of choosing between clinical trials that are going to fail or a drug off the shelf. She was not able to push for a higher standard of care. She was not able to push for drugs herself. So we had to, as her caregivers, as her parents, we wanted to assemble a care team that crossed all lines, from clinicians to researchers to people on the psychosocial level, to a care manager through the insurance company. And we didn't necessarily want everybody to agree, frankly. And I'll talk about that later on. What we wanted to be able to make a decision based upon all the information we got and ensure that we were pushing for the top care that she could achieve. Now, we were very fortunate. Her mother's a lawyer and I'm a lawyer, so we had the education, training, knowledge, and background to try and advocate for her. Clinicians these days have so many patients, and as insurance carriers change the metrics for reimbursements, they're seeing more and more patients. And so your family member, your loved one, your friend, I'm not saying they're going to get lost in the shuffle, but you've got to ensure that you're pushing for them at every stop and at every turn. Why do we need to advocate? This kind of dovetails on the last slide. Again, it's your family member. It's not just another patient. When my daughter was diagnosed, I always said that, look, she's just not another number. We were told from day one that she was terminal. And so could have gone one of several directions. We could have believed the diagnosis in terms of how many months she had to live, or we could have advocated to get her on different clinical trials or access to drugs or access to services that if we didn't push for them, nobody else would have. There's social work teams at every institution, at every clinic, at every hospital. Again, these social workers have so many different patients that they see and so many patients that they interact with that they just simply can't be the advocate for your family member, for your loved one all the time. Not that other patients aren't important, but your family member, your loved one, my daughter, to me, she was the most important patient that was being treated by her clinical team. It's advocating as a caregiver is speaking up when necessary. It's making sure that, again, you're thinking about all of the different spokes on that bicycle wheel. It's not trying to create tension between yourself and the clinical team. It's trying to ensure that your loved one, your daughter, your child, your mother, your father, your wife, your cousin, your aunt, your uncle, your best friend gets the care that they deserve. Again, if you're not advocating for them, who is? An example with my daughter is she was very young at diagnosis. Anytime she had an MRI or a procedure, she had to be sedated. She had to be put out. Normally, the younger patients get the earlier cases in the morning because they have to fast. They can't drink water. You can't eat for 8 hours. Well, there were a number of times when we would arrive in the morning for an MRI or a procedure, and something inevitably would complicate the time that she would get to go back into the radiation suite or into the MRI machine. Hours would pass. And at first, it was a very foreign world. So neither her mother or father, we didn't really know how to push. But after the third or fourth or fifth time, we knew how to advocate for her, and we would not take no for an answer. This is a 27-month-old child that was on steroids that made her ravenous. So we had to continue to push like crazy. There was another time when she was early on after diagnosis, she had a central line that went directly into her heart to administer medication. It became infected, and she was hospitalized for 5 days. She did not do well in the hospital. As each day passed, you could see her psychological condition deteriorating. And nobody really knew what to do. The attending oncologists wanted to keep her. The infectious disease specialist figured that as soon as we could isolate the strain, we could take her home and administer the antibiotics ourselves. And there became this entire head-butting situation where I saw my daughter deteriorating quickly, and I had to advocate for her to have her released and convince them that her mother and father were capable of taking care of her and administering antibiotics. And we knew that if anything changed, we would take her back in. Again, this was my daughter. To them, they were being very conservative, and I appreciate that, and being very cautious, but they didn't see the ultimate toll that it was taking. Another reason why advocating as a caregiver for somebody else is extremely important is because access to care is such a complex issue. And that can mean so many different things. That can mean access to treatment. That can mean access to facilities. That can mean access to diagnostic testing. Think about women who have family members who have a history of the BRCA gene, and they know that family member after family member have tested positive or have been diagnosed with breast cancer, and it's been driven by the BRCA gene. They have to fight their insurance company to obtain, mammograms and to do genetic testing to see if, in fact, they're a carrier. That shouldn't be the case. They advocate for themselves, but again, in the case of a 27-month-old, my daughter could not advocate. There's another example that I want to cite with respect to ensuring access to care and advocacy. There's an individual who's very close to me whose son has some serious medical conditions, undiagnosed because they don't know exactly what's wrong with him. It's an auto-inflammatory condition. And as his clinical team was trying to figure out what the issue is and what potential treatments to utilize, and this is a kid that gets fevers over 107 degrees, she was forced to, once told what drug to potentially try, she was forced to go to the drug company and essentially tell them that if her son dies, it's on their hands, because she couldn't afford the drug. So thankfully, she was able to reach high enough up the chain, found somebody who was sympathetic enough, and the drug company has given her the drug for free. But there's an instance where access to care, access to a drug that this child's clinical team thought would work, and in fact worked for around a year, said, let's try it. she couldn't afford it. So she took it upon herself to advocate in a way that it would have gone one of two ways. Either they would not have been swayed, or she was able to hit the ball out of the park and get the drug for free. Access to care also means, that you're going to have to deal, in thinking about the bicycle wheel and spokes, you're going to have to deal with your insurance carrier to fight for various treatments, various diagnostic tests. So you're advocating on so many different fronts. And when you're dealing with somebody with a life-threatening or terminal illness, be prepared to have to fight a lot of battles on a lot of different fronts. I think this is a slide and an area that we could probably spend an entire day or entire week talking about, advocating to ensure that you have access to care. And we aren't even touching on underprivileged communities, touching on communities that don't have access to care in general. There's a lot that goes into this component of the equation. The next area that I think is important to think about when advocating is trying to create the best care team possible for whatever situation it is. Look, again, you've got to start with the assumption that the clinical team that you're going to deal with cares about your child, your mother, your father, your wife, your cousin, your best friend. But again, they have so many different patients that they're rushed in and out of treatment rooms left and right. When my daughter was diagnosed, there were 4 or 5 people that were world-renowned in what she had as neuro-oncologists. And so it was important for us to try and gather as many people onto the team as possible. Some diseases, some illnesses, they aren't as complex, so to speak. But if you can, advocating for clinicians and nurses and hospitals and facilities that are the top-notch places for whatever you need to address, that's critical and key. In my daughter's case, when we brought new people onto the team, I didn't really care whether any of the other clinicians minded or were offended. I would always tell them that, look, we've consulted with so-and-so and we're getting opinions from that researcher or that clinician because we want to know as much as possible. Number one, when you think about cancer care and think about patients that have terminal diagnoses, you're looking at clinical trials, because obviously if there was something off the shelf that could be given, we'd give it to them. We'd get access to that drug. In this case with my daughter, we were looking at phase 1 clinical trials, which are only looking at toxicity. Are we going to kill the patient? And what is the highest tolerable level of a drug that we can give? You're not even looking at efficacy at that point. So I didn't mind when there were disagreements in terms of recommended treatments or a course to take with Alexis. That didn't bother me. Actually, I appreciated it, and it gave us something to discuss. There wasn't a set protocol, so it allowed us to debate the merits of a specific treatment and then make an informed decision. Again, I think a lot of this does presuppose that you have access to the internet and a computer to do your own research, that you have access to and an ability to communicate with other researchers and clinicians that might not be within your local area. I think the first thing that you should do is research who shows up as the top individual in the field, be it on a psychosocial level, a clinical level, facility, it doesn't matter. And then try and figure out what you need to do to get to that person and bring them on the team. Okay. This, I think, is an important topic to talk about, when to advocate, knowing when to push and when not to push. There were often times when I butted heads with Alexis's clinical team. Being a lawyer, I was at points in times very aggressive. With that said, it was my daughter, and again, I had to be aggressive because not that her clinical team didn't care about her, and frankly, her clinical oncologist retired after Alexis passed away and cited Alexis's death as the reason why she couldn't practice anymore. She was done. There's an instance that sticks out in my mind when Alexis had the infection in her line and she was hospitalized. Hospitals are not the best place to get better. In fact, they're horrible places to get better. And if there are any healthcare providers on here, hopefully I'm not offending anyone. But think about a 2-year-old child. She took naps in the afternoon. Sometimes she took naps in the morning. Sleep was very important to us as her parents to ensure that she got as much rest as possible. Through the course of the night, there's people coming in and taking her vital signs. There's people, giving her medicine. There's, we were close to the helicopter pad. There's overhead announcements. There's light coming in from the hallway. It became a routine every time we had to be hospitalized. We brought a hammer, we brought nails, and we brought extra sheets to hammer into the walls to make the room darker. But we talked to her nurses about trying to extend the periods of time that they would come in and poke and prod her so that she could get her nap, so that she could sleep through the night. And we wrote down a schedule. It was agreed upon. Everything was going great for about an hour, and then it all went out the window. And so I asked to speak with the nurse in charge of all the nurses in the pediatric facility. And she was a woman that the nurses themselves did not like, and I immediately didn't like her either. And we butted heads very quickly. And I was told by her that the nurses actually were coming to fear me, and so they didn't want to deal with me. At the time, I thought it was a badge of honor that I was making the nurses fear me. In the end, the nursing teams at all the facilities that my daughter was treated at were the most amazing people on the face of the earth, and I still keep in contact with some of them. But that's an instance where I might have been a bit of a jerk, and it may have cost my daughter a little bit. And so as you think about what you're advocating for, obviously if there's a drug that you're trying to advocate for and trying to get your hands on, and you're being told no, and that drug it's the drug that's going to save your child or save your husband, your wife, your mother, your father, then you've got to pull out all the stops. In one of my roles as the executive director for the Max Care Foundation, we've helped people obtain drugs through compassionate use, expanded access. And quickly, I'll tell a story about a child that was treated at St. Jude who had battled a type of cancer for about 3 years or so, 4 years, and then contracted something called the adenovirus, which is pretty common after having bone marrow transplants, which a lot of children with cancer have. St. Jude had done a phase 2 clinical trial on something called, I can never pronounce this drug. Needless to say, this drug had proven effective in phase 2 trials to wipe out the adenovirus. Well, the drug company that was manufacturing the drug was in phase 3 with the drug, which meant that the drug was close to the close to the end line, close to the goal line of development. And sorry, I lost the slide there. Joe, it looked like we got a notice that conference would end in 10 minutes. But I'm almost done, then we can take some questions. Long story short is the kid was given 3 days to live, 2 to 3 days to live, given the rapidly reproducing bacteria. St. Jude knew that this drug would effectively kill the adenovirus. The drug company refused to give the drug out on compassionate use to anybody because they were so close to the finish line on getting the drug approved by the FDA. The Max Cure Foundation came in and started advocating on behalf of the boy, Josh Hardy. Some of you may have heard of him. And it became international news. Within 48 hours, there was 1.5 million social media impressions on it. The advocacy ratcheted up so high that the CEO ultimately relented at the 11th hour, went to the FDA, created a phase 3 clinical trial for 20 children, written basically with Josh as the first child, gave the drug to Josh, put it on a plane. Josh lived. The drug wiped out the adenovirus. The CEO got fired, and the rest is history. So knowing when to push, how to push, and how hard to push is something that only you can tell. But be wary, because you don't want to spend all of your capital pushing for something that in the end is insignificant, that when and if you do need something like a drug or access to better care, or to get your child in the first MRI slot, or to get your husband or wife seen immediately, you don't want to waste the capital that you could spend later on. So finding that balance is tough. And again, this slide, I think, dovetails with the last one. You've got to balance out exactly what you're trying to advocate for and how you're advocating. And, in the story that I shared with you with respect to the nursing, the head of nursing, in the end, everything was okay, but that could have been very, very costly for my daughter in terms of the quality of care that she received. And, ultimately I apologized to the head of nursing, but at the time, you're in the heat of the moment, and I was watching Alexis go downhill very quickly. I wanted to get her out. It was a Friday night when we finally got the papers signed to get her out, and 2 of her clinical team are religious and observant, and I had their cell phone numbers, something else that I would highly suggest that you do at every turn if you can. Obtain your clinical care team's cell phone numbers, email addresses, and you got to reach out to them. And I did. I reached out to them, and I brought one of them into the hospital on a Friday night, and I told them that my daughter was getting out because she was going to die. I knew that she was not going to do well if she stayed in the hospital. It was an episode that taught me a lot in terms of how to advocate and how hard to advocate and what to advocate for. So, again, there's risks and there's benefits, and only you can assess that in the context of what you're trying to advocate for. Obviously, if you're advocating with an insurance carrier about trying to gain test or gain access to some care, you don't have much to lose there. You can go through the appeals process, but insurance carriers are becoming more and more savvy. And a lot of them, if you're dealing with a critically ill patient or a patient with a life-threatening condition, will have a patient care coordinator that will be assigned to you. For my daughter, she had a really, really good one. Sometimes she contacted us a little bit too much, and it became a little bit too intense to continue to interact with her. But with that said, she was really on top of things. So that is the end of my presentation. I'll take some questions. Let me unmute everybody here. if anybody has any questions, go ahead and ask. And maybe, Joe, should I just unmute as somebody asks a question? What's the best part?
Anybody who has a question should ask.
Okay. Anybody have any questions? Nobody?
Yeah, I have a question.
Sure.
You know, one of the major issues is finding the right balance between pushing and just going with the flow. And you mentioned that at some point, I'm getting a bad echo. You said at some point the nurses were afraid of you. And so what are some of the things that you think we ought to ask ourselves to decide whether or not it's worth pushing or whether or not we should say nothing and just go with the flow?
I think the first thing is, how critical of an issue is it? If you're advocating for somebody and trying to get a private room, you know, how critical is having a private room versus having a shared room? You know, where does that fall on the continuum of what's important? If you know that you're going to have to advocate in the end for something that is critical for that individual's care, you know, you may want to let certain things go. You know, I think in my mind, the balance is struck by understanding the situation, understanding what the illness is, and what the potential complexities are along the way. You know, I mentioned underserved populations, and access to care is not something that is prevalent in you know, minority populations, underserved communities, for any number of reasons. And so there's organizations that are out there that will help advocate for those that may not have the background, or may be afraid that if they speak up, you know, they may get hurt in the back end. You know, I don't have a situation where I pushed to a point where my daughter was, you know, negatively impacted. I will tell you that one of her two main neuro-oncologists, we had an exchange where he turned to me and he accused me of deposing him one night. And I said to him, no, I'm not deposing you. I'm just asking questions so I can get an answer. We actually have a really good relationship now, and I still work with him in different contexts. So you've got to find that balance yourself as you're pushing for the patient. And if you can't do it, then seek help, because there's people out there that will help. And I've helped a number of families, and I've helped a number of immigrant families whose children have been diagnosed with cancer, got them access to services and treatments and drugs. There's help out there. And maybe, perhaps that's a good topic for another presentation. There's places to go for people to help. Quickly, are there any other questions? Anyone? Okay. Well, my information is on the biography there. I have my own website and Twitter there. If you have any questions that you didn't want to ask, or that you think of any time, or you need help advocating, hit me up, let me know, and if I can help, I'll see what I can do. So, thank you. I hope everybody got something out of this.